Lipodystrophy is a condition where the body loses its normal amount of fat tissue. It can be present at birth, congenital, or appear later in life, acquired. Because fat helps store energy and makes hormones, people with lipodystrophy often feel very thin, may look muscular, and can develop problems like high blood sugar. Example, imagine a child who looks unusually skinny even though they eat well. That could be a sign of congenital lipodystrophy. Explanation: the causes are different for the two types. Congenital lipodystrophy is usually caused by inherited gene changes, such as mutations in the LMNA or PPARG genes, which tell the body how to make and keep fat. Acquired lipodystrophy can be triggered by autoimmune diseases, for example, lupus, certain medicines like some HIV drugs, infections, or injury to the skin. Example, an adult starting a new HIV medication may notice that the fat on their face and arms starts to shrink, indicating an acquired form. People with lipodystrophy often notice visible loss of subcutaneous fat, skin feels smooth and shiny, a more pronounced muscle look, especially in the limbs and face, cold intolerance because fat normally keeps you warm, metabolic issues such as high blood sugar, high triglycerides, and fatty liver. Example, a teenager may complain that they get cold easily and that blood tests show elevated cholesterol, even though they exercise regularly. Doctors diagnose lipodystrophy by a combination of steps: physical exam to see where fat is missing, imaging tests like DXA scans or MRI that measure body fat distribution, blood tests for sugar, lipids, and hormone levels leptin, genetic testing for congenital cases. Treatment focuses on managing the metabolic complications and, when possible, restoring lost fat. Options include a low-carb, balanced diet and regular exercise, medicines such as meterleptin, a hormone replacement, or insulin sensitizers, metformin, thiazolidinediens, cosmetic procedures, fat grafting for severe physical changes. Example, after a DXA scan shows almost no fat on the arms, the doctor may prescribe meterleptin injections to help control the patient's blood sugar. While you cannot stop congenital lipodystrophy, you can reduce the risk of the acquired type. Talk to your doctor before starting medicines known to affect fat, for example, certain HIV or steroid drugs. Keep autoimmune diseases well controlled with proper treatment. Avoid repeated bruises or infections of the skin that can trigger localized loss. Family members of a known genetic case can consider genetic counseling before having children. Example, a patient with lupus works closely with a rheumatologist to keep inflammation low, thereby lowering the chance of developing lipodystrophy later. Recent advances are giving hope to people with lipodystrophy. In 2018, meterleptin was approved in many countries and has shown improvement in blood sugar and liver fat. Researchers are testing new drugs that activate the PPAR gamma pathway to help the body store fat more normally. Gene editing tools like CRISPR are being explored in animal models to correct the underlying genetic defects. Early-stage trials of stem cell-derived fat tissue are also underway. Example, a 2023 study reported that patients receiving a newer PPAR gamma agonist had a